Hi again, everybody. Welcome back. I hope you all are doing well. And this week I have a few different updates for you from this past week on my wrist and my wrist surgery, as well as my orthodontics and getting started with that treatment again and what the plan is going forward. And also with some of the healing modalities that I have started in this past week. So if you saw my last video, you know that I broke my wrist a couple of weeks ago. I actually just had surgery last week, exactly 1 week ago. So now I do have this removable splint, which is way easier to deal with than like the big bandage that I had on before. It's still kind of annoying, but this is much, much better. So I had surgery last Friday and really right away started doing some PT and just like I got a lot more mobility back pretty immediately, but it's definitely been very sore. It's kind of painful. So in comparison to my jaw surgery, which obviously was much more of a major surgery, it's kind of been an interesting comparison because this wrist surgery for sure has been more painful. With the jaw surgery, there was a lot of discomfort from the swelling and the drainage and everything. It was certainly not a fun process, but there was very little actual pain, I think just because everything was so numb. And with this, it really, for like the past 2 weeks since I broke it, has been sort of constant pain. And it's manageable, taking pain meds and everything, but you can only sort of dull it so much and it's sort of always there. And because I'm using my right side a lot more and I'm kind of like only able to use my left hand so much, like my whole body is kind of crooked now and just like everything on my left side kind of is sore and my right side is being overused. So it's definitely been feeling like this has actually felt like a worse experience than recovery from my jaw surgery, even though that was definitely more drawn out. And there were a lot of things there that were difficult in terms of eating, but just in terms of actual pain and like ability to kind of do day-to-day activities, this has been kind of challenging. And the other interesting thing is that with this wrist surgery, I actually have a really big incision on my wrist. So they did have to put in a little plate to hold the bone together to fix it or whatever. And the jaw surgery again was so minimally invasive and they did very, very small incisions inside my mouth. So there's no scarring. And I'm not quite sure why with this wrist surgery, they had to do like such a huge incision. I'm going to put up a picture. So if you don't want to see a picture of sort of the big scar there, you might want to just look away for a moment. But if anybody knows why this kind of surgery is not done, more minimally invasive, or, if there's not, I think there are ways to do that, but I guess I just don't understand why with this particular surgery it had to make such a large incision. So that was kind of surprising. And again, it's just been a very different recovery process, but I'm actually really glad that I had just gone through this jaw surgery recovery, because I feel like the one part that was a lot easier was just sort of understanding how the process would go, that like there was going to be inflammation and bruising and I was going to have very limited range of motion right away, but that a lot of that will go away just as the swelling goes down. And I think if I hadn't just done this jaw surgery and kind of seen how that played out in the first couple of weeks, I probably would have been freaking out a little bit more about my wrist, because right now it is very swollen and I really have very, very limited range of motion. So with the physical therapy exercises that I'm doing right now, when I compare with my other arm, like I can barely move my left wrist around and like do the different exercises. And I think I probably would have been pretty nervous that like, is this ever going to get better, or how am I going to like, get my strength back? But just knowing what a big change I've had in my jaw and my ability to, talk and eat and all of those things, knowing that this is going to get better really quickly, I think has just been mentally really helpful to have gone through that experience beforehand. Last week, I also went to my orthodontist again to start up treatment for the first time since my jaw surgery. So it's been over 3 months. I think I'm almost at like 15, 16 weeks right now from the jaw surgery. And we got the okay from my surgeon that everything looks good and we can start treatment again. So I went back in this past week and we did a couple of things. One, they just gave me new bands all the way, across my wires and everything, which was nice because I'd had those old ones on since before surgery, which is like kind of a long time. And they also took off the little surgical hooks that I had placed on during the surgery. So the surgeon had put some hooks like on the front in case we needed to use those for rubber bands during the healing process. We didn't actually end up using them. So it kind of had these little like things poking at me for a long time. So I was really glad to get those taken off of the wires. And then we also switched up the pattern of the rubber bands that I'm wearing. So you can see before I had like a big box pattern that kind of just like held my whole jaw in place during the initial recovery. And now that we can kind of see where things are settling and where we need to kind of move my teeth to make everything more perfect, we are kind of trying to shift the lower teeth back just a little bit, and just like, I guess, create better occlusion and everything. So a little bit different with the rubber bands right now. We'll be wearing these for the next 6 weeks, and then I'll go back. We're going to check in again, redo some photos, and kind of go from there. She did say that she didn't think I had too much longer that I would need to be wearing the braces. I did not get like an exact estimate of what that means, but hopefully, it won't be a super long time. We'll be able to kind of get everything where it needs to be fairly quickly. So that was good news. My teeth are definitely sore. We didn't actually change the wires out, but I think just putting like the new bands on and everything, it's just tighter. So my teeth have been a little bit sore, but not too bad. And since I'm already taking pain meds for my wrist, I guess I haven't really noticed it too much. And the other thing that I've been doing this past week was I got started with some of my hyperbaric oxygen therapy sessions, and also doing a few more red light therapy sessions and IV. So it definitely has been kind of a lot, but I think especially with having this wrist surgery and really wanting to get through this recovery process as quickly as possible, I've just been trying to do as much as I possibly can to sort of support my body through this healing process, and also, again, to kind of try to address some of these deeper, longer term health issues, and just see if I really hit this hard, like what kind of progress I can make. So this past week I did 3 sessions in the hyperbaric oxygen chamber. The goal is to do like kind of as many as I can each week, like up to 5 per week until I've done 20 sessions. So I got 3 in this week. So far so good on that. It's the only like sometimes issues that can come up with that is like with the pressurization in the chamber, like your ears can pop, and like sometimes, you just want to make sure that everything is like equalizing properly when you come out. That's all been fine. I usually just end up kind of taking a nap in there because I'm in there for about an hour. I might bring a book or something like that, but I really just end up like laying down and taking a nap most of the time. And then I also did a couple more sessions of the red light therapy, specifically to try to help with the healing from the wrist surgery. And I'm going to try to continue to do some of those going forward, especially once I get this or can take this splint off and where the incision is, to try to help prevent scarring and kind of help the skin to heal. And then I did another IV nutrient therapy appointment. So I'll be doing those about once a week for the next 8 to 12 weeks. And I'm going to be cycling through 3 different protocols with different mixes of nutrients and stuff like that. I don't know everything that is in all of them, but we're just going to kind of try 3 different things so that I can get like a good, range of different nutrients and kind of see how that makes me feel over the next couple of months. Next week, I also will be getting some blood work done to get some baseline measurements of some of these nutrients and some other like hormone levels and things like that, just to have a good idea of where I am right now. And then we'll kind of retest after I've done all of these hyperbaric oxygen sessions and finished up the 2 to 3 months of IV therapy, kind of retest things again and see if there's any changes there, while also tracking any just changes that I'm noticing in terms of how I'm feeling or energy levels, and maybe just kind of general healing with both my wrist and my jaw. So I'm curious to see what the blood work shows, and we'll be interested to see if there's any changes over the next couple of months while I'm doing all of these therapies, or after I finish doing a series of sessions with all of these things. So next week, I will be continuing to do some more of the hyperbaric oxygen therapy and getting another IV therapy session in. I also am going to be seeing another sort of body work specialist to do some work on like my wrist and my arm from the impact of falling. I'll tell you more about that next week, as well as next week I'm going to talk more about medications and supplements that I have been using over the past years, or that have been most helpful for me over these past many years of dealing with like chronic fatigue and brain fog and hormonal disruptions, and just kind of going over what things I'm using now that maybe I'm hoping to eventually be able to not have to use, but what are the things that have been most helpful in terms of kind of managing my symptoms and kind of getting me further along in terms of progress than I had been able to get just on my own, or just kind of like doing lifestyle changes. So that will be coming up next week. If you like this video, please give it a thumbs up or leave any questions or comments below. I'd love to hear from you guys. And as always, thank you for watching. I really appreciate all the support, and have a good week. I'll see you next time.